How do we take the things that we know about vitamin D and move them into massive health practices right now? I'm Carole Baggerly, and I'm here today to ask you for your help in doing exactly that. It has been 10 years since I started the organization called GrassrootsHealth, of which I am still the director. We have published quite a number of papers, 2 within the last 12 months, that should have sent thousands and thousands of people to action. One of them about vitamin D and cancer incidence amongst women, and this showed a full 65 to 70% reduction in the incidence of all cancers in women. The other was a publication out of a hospital that we did, a project that we did in using vitamin D and its effect on preventing preterm births. It demonstrated fully that the RCT that had been done of showing 50% reduction in preterm births would indeed validated. Again, we have to move these out faster and to have more and more people get on with it. We don't have time. Our bodies don't have time. Our lives don't have time to continue to have these diseases when we could prevent them. This last month has been Breast Cancer Prevention Month around the United States, and we chose to call it Cancer Prevention Month. I fully expected, I really expected to hear from a number of breast cancer organizations saying, please tell me what you know about breast cancer and vitamin D. I didn't hear from even one. As a matter of fact, I made personal contact with several, and the answer I got about my coming to visit them, even when I had to fly to go there, was, I'm sorry, we're too busy right now. Would you please tell me how you can be too busy to prevent cancer? I was appalled. I was appalled. And these were all from people who really know nothing about vitamin D. And they weren't ready to hear the message. We'd like to change that. And based on my relatively long experience in the field of sales and marketing, what we see at Grassroots Health that we need to do to make this happen is to add a sales and marketing team. We have had me out front of a lot of people from time to time, but we do not have a full-time sales staff or a full-time marketing staff. We need that. We need a PR group to work with us. We need to have advertisements, literally paid ads in TV, certainly in the internet and newspapers, medical journals, to say this exists. How do we take advantage of it right now? The process of getting involved and making sure one's vitamin D serum levels are at least in the range of 40 to 60 nanograms per milliliter, 100 to 150 nanomoles per liter, is very simple. All you have to do is test your vitamin D level and then follow up in a few months to see, did you achieve that by adding supplementation, and what supplementation is it going to take for you? This needs to happen now. But we need more people. We, Grassroots Health, need more people to make this happen. As I mentioned, we need the sales and marketing people, we need the PR people, we need programmers to help create the infrastructure that we will need with additional things to track and new health outcomes. As I mentioned, again, it works for everybody. It works for the insurers, too. I didn't mention that. It works for the hospitals, and we already know it works for individuals. And it can work for the entire United States health issues. Fully 35% of our health problems are a result of vitamin D deficiency. Please help us right now to add these functions to more aggressively get the word out about what can be done about vitamin D, how safe it is, how easy it is, and how inexpensive it is. All donations will be appreciated, small, big, enormous, slightly bigger, whatever you choose that fits you or your organization's abilities. Please help today. Thank you so much.